Thank you for participating on behalf of the Steffens Scleroderma Foundation. How long have you had scleroderma?
I was diagnosed in October of 2015.
What do you feel are the benefits for patients and students in participating in the Scleroderma Awareness Program tonight?
I think it helps the students be able to see and see us in person and really know how it affects us. And scleroderma, we're all so different. So they see the story of the guest speaker, but then the rest of us may have a different aspect to it to help the students know for their journey and when they get done with school. I think that's what helps them, so they can have a face to the disease, I guess.
What do you consider important or unique about scleroderma that students from these various disciplines learned from you?
I think the main thing is that each scleroderma patient is completely different. What we have, what our obstacles are, and what we have to deal with every day. For me, like visually, I don't look sick, but I'm in constant pain all the time. Some of the digestion things for me are completely different than other patients. Like, for instance, for me, drinking flat liquids like water is harder to digest than carbonated drinks, which is totally different than most people. So that's why I think it's good that they see many of us here and to visually see how different it is per person. And I think that's one of the unique things about scleroderma is not one treatment is going to help every person, and not every person goes through the same stuff.
Are there any suggestions that you have for improving this awareness program?
No, not really. I think the program is really great. Maybe more time for the students to have the one-on-ones with the patients, but that's it. I think that it went really well, and I think it's really great. I was here last year, so it's my second year, and I think that it's just very beneficial for all of us.
Thank you very much.
You're welcome.
How long have you had scleroderma?
I have had scleroderma for about 12 years.
What do you feel are the benefits for patients and students in participating in this Scleroderma Awareness Program?
Well, I think like most everyone else who's probably said pretty much the same thing is that I think we both get to know a little bit more intimately, what like we get to look into the faces of the medical field. They get to look into the face of someone who has scleroderma, and we can just try to relate to each other as provider and patient.
What do you consider important or unique about scleroderma that students from these various disciplines learned from you tonight?
Well, you know what? I think my situation is unique in that I am not on medications and I'm not on conventional therapies like most people are. I took a natural approach, although initially when I was diagnosed, I did go in the way of an antibiotic, which was very unique and very rare, but I did take an antibiotic for 3 years, and I believe that it began to kill off the bacteria. It turned my situation around. I went from almost not walking. I went from definitely having all of the symptoms of scleroderma, which was the tightening of the skin and, not being able to close my hands, all of those things, to being able to be, mobile again. And so they learned a lot today because I was not the average scleroderma patient. And then I was able to just learn what their whole therapies are about, or what their professions, the areas that they were going to go into, like occupational and, the psychology. And, I was able to just sit and learn about, what their role would be to help the scleroderma patient.
Do you have suggestions for making this awareness program even more valuable?
You know what? I think it was really awesome because this was my first time coming, and I was just really grateful, to be here. Once I got here and once I sat and listened to the students, I was really grateful because they cared, and I loved that they cared, and they really made me feel comfortable and they made me feel good. And personally, I can't see where you could really improve on it because it was just really, for me, it was good. My first time out. Again, because I chose a natural route, I don't know if maybe they want to incorporate, testimonies or, from someone who does an alternative path as opposed to, going the regular, medicinal way.
Thank you very much.
You're welcome.
Okay. How long have you had scleroderma?
I've been diagnosed 5.5 years now.
What do you feel are the benefits for patients and students in participating in this scleroderma awareness program?
Well, the benefit for me was just being invited, being able to participate. It's psychologically, it's a good benefit to help myself, being able to give back to the scleroderma community. I think it's like the least I could do. I got to learn a lot of aspects from the students on their perspectives of what they're doing in their education and how to benefit us as patients. In return for that, I was able to give them insightful answers of my specific things to help them. One of the simple questions was about dexterity, and I actually have a difficulty time picking up like little pens and all. And we talked about, is it, can you moisturize your hands? Can you do something else? And it's not it. It's just the finite thing of the feeling in my fingertips and how that works for them. So they found that was rather insightful. So right down to a finite answer to the broad spectrum of just being able to be here and give back.
Thank you. What do you consider important or unique about scleroderma that students from these various disciplines learned from you?
And when I listen to the questions, I not just answer the exact question, but what's the motivation behind that? Where is it taking from them? That we delved into, I can't think of an example at the top of my head, strangely enough, but that was an important piece. And from there, we were able to ask more questions down that avenue.
I understand.
Yeah, I hope that helps.
It does help very much. I understand completely. Do you have suggestions for making this program more valuable? Or
no, it was fantastic.
Future?
It was fantastic just the way it was. I think over time it might metamorphose, if that's the proper word, into something that will naturally improve itself. I anticipate, but I would think. But it was great. This is the second year. It's been very helpful.
Thank you very much.
You're welcome. Thank you.
Bye-bye.
Thank you.